I'm remembering when South Africa had, in the early 2000s, with the sort of re-emergence, kind of the large scale of xenophobia, and it was found that in a lot of instances, average South Africans didn't often meet people from elsewhere on the African continent, but they somehow held xenophobic views. And so a lot of this was then traced to pronouncements by public officials, just people's skepticism about the fact that that their economic situation wasn't improving, and so they displaced that anger, the frustration onto somebody who was in the same position as theirs. And we just look at we just saw the South African Chief Justice, the image of him. I think he sort of made comments about how COVID was some satanic conspiracy, the mark of the beast, etc. Where do you think the skepticism come from? And you've mentioned sort of also like the state's inability to perform, corruption, waste. Do you think that all these things have kind of contributed to people getting into all kinds of weird theories about COVID, that it doesn't exist, or that, now with the vaccine, I won't take the vaccine because I'm looking at some website telling me not to?
Yeah, I mean, definitely the government's track record is a part of the problem. But then there's a lot of fear, there's a lot of ignorance, just, understanding basic science, understanding how vaccines work, how infectious diseases spread, where this virus came from. I would say that, in terms of a mass education program, the government has tried, but it's not adequate. And some of these questions are rooted in fear and distrust and xenophobia. I mean, at the beginning of the pandemic, this coronavirus was referred to as a Chinese virus. So, it's things like that. And if as a country you haven't addressed xenophobia, then of course that kind of sentiment latches on very easily. If you have a country where the health system is just failing people every day, it's failing 80% of this population. And just to say that, William referred to this in his paper, in his article, that Ipsos survey, you got to look at who the respondents were, and that they were mostly urban people, probably with a solid income or something, and they have the choice to say, I don't want this vaccine. But 80% of our population uses the public sector, and in the public sector, vaccines are part of the service. That's like one of the things you're not even going to be asked if you want or not. So those are the people that are going to come to clinics and expect to be vaccinated, and then probably going to be met with the same issues that have plagued the service forever. And so there's a lot of distrust and fear that that is across all I would say classes of society, all races in South Africa. There's just different reasons for this kind of vaccine skepticism.
I mean, you touched on exactly what I wanted to talk about next, because I think, referencing what I wrote about in the article, this is purely based off anecdote, which is that a lot of the vaccine skepticism seems to have this kind of distinctive middle-class character to it, just because a lot of the reasons given for it always are in advance of something else. So a lot of people saying don't take the vaccine or saying don't do it because it's an imperialist plot by the West to insert microchips into Africans and then control them and entrench their world domination. And then on the other end, there's a lot of people saying don't take the vaccine because you can't trust this government, and better trust these alternative medicine practitioners like Tim Noakes, who are telling us to not take the vaccine. So, and it's also this group of people that are spending a lot of their time on social media, who are getting completely sort of absorbed in a lot of the stuff. But I suppose the question I want to ask in relation to that is, do you think it's also, I mean, you spoke about the government's mass education campaign, and I've started to see some of this begin in earnest over the last few weeks as the anti-vax hysteria has gone into overdrive. But is it also a failure of the government's inability to sort of, from the beginning of the pandemic, spread information about not only the virus and infectious diseases generally, but also about how it's going to be vaccinating the population and so on and so forth. And I get the sense that there's also a lot of ambivalence at the level of the national government as far as wanting to immunize the population. A lot of figures there seem like they're not very trustworthy of the vaccines, and it just seems to be translating into their very sluggish efforts to try and educate the public as far as what immunization entails.
Yeah, so I would say that, when the pandemic hit us, there was really no discussion at that point about vaccines. We never thought that within the space of a year we'd have vaccines, because traditionally vaccine research and development takes years. So that is also part of why people ask, they have doubts about this vaccine. A lot of the questions from healthcare workers is, how is this possible that we have a vaccine so quickly? How do you know it's safe? And that really comes down to the fact that a massive amount of resources have been put into developing this vaccine to address the COVID pandemic. But I mean, so now very quickly our government has to face the fact that there is a vaccine. How are they going to get it? How are they going to administer it? And so, I think just this poor management of the entire pandemic has just led to a lot of stumbling along the way. And yeah, I'm not sure if that answers your question, William. Maybe you.
Yeah. I was just going to say, it sounds like a correct picture, which is that it's almost like a lot of people are doing this to get back at the government, almost like the vaccine skepticism, as far as what you're describing now, is a sense of everything has gone so badly before, and now this final stretch, when there's a sudden expectation that you're supposed to jab yourself.
I'm going to be more blunt. I think it's like two sets of people. It's one, the kind of like, it's ANC politics where you have Zuma supporters who would like to see the Ramaphosa government, which is by the way very good at like what do people say? He's really good at the like TV statement to make him fail. So that's sort of there, and so they're tapping into lots of discourses and stuff that is shared with them on Twitter and Facebook and whatever. And then I think there's a sort of kind of white reactionary bit of South Africa that also gets its information from, another circuit, which is sort of white supremacy, Trumpism, and it's very obvious that that's the case. But I want to just link to that. There's also like in the US, where I'm currently based, there's also like medical doctors who engage in quackery and skepticism. There's a lot of these TV doctors. I can just think of this one example, this guy called Dr. Oz. And I think there's one other one, like you'll see them on Fox, you'll see them on CNN, touting all kinds of crazy stuff. Is that the case? And I know we're just talking about South Africa, but is that the case also in South Africa, that you have people who are in the medical profession who say some of these same sort of bizarre, promote bizarre theories and vaccine skepticism? I know with this, whether Tim Noakes is not a medical doctor, right? He's a nutritionist. But he's this sort of like poster boy for that kind of politics. How is that stuff? Does it matter? Is it widespread at all? And then I know I'm making this question very long, but I'm also there's always something that made me think, which is, so when there's surveys and we mentioned this, they'll say the sample was mostly urban based. Does that mean that rural people in South Africa trust the public health system, trust doctors, or can we not make that conclusion? Does it mean that poor Black South Africans trust the public health system, even if it doesn't perform for them? Or can we not make that conclusion?
One thing to add to that, which I think is interesting, is that globally, anti-vaccine skepticism tends to have a higher prevalence in wealthier countries than in poorer countries. Does that translate to the class structure of the countries themselves?
Okay, thanks. So let me try to answer Sean. So, linking back to the HIV/AIDS pandemic, we had a proliferation of quackery. The Minister of Health at the time was also promoting a lot of root vegetables as treatment for AIDS. And then there was a lot of campaigning from the TAC, from scientists as well, who were at the same time sidelined, but they kept up the fight and they brought all of the scientific evidence to light, and they kept saying that, this doesn't work and these people should be basically silenced. We shouldn't be listening to them. And I was really hoping that our government would refer to that struggle in this new struggle, because it's basically the same thing. We have a lot of people who are talking. There's so many. You turn any corner and you're going to find somebody selling a cure or potential treatment or something to COVID, or if it's not that, then it's a conspiracy theory. But we also have real doctors who are on the front line, who are dealing with like hundreds of COVID cases every day. Their ICUs are packed, their patients are dying, they're running out of ventilators, they are desperate. And this is probably something they've never experienced before. So there are a lot of impassioned pleas on social media. There are petitions going around. Just today on national radio, I heard a doctor speaking about a drug that's currently another controversy known as ivermectin. It's used to treat parasitic infections. This doctor spoke very well about how it might, reduce either treat the disease or prevent infection for COVID, and that she's planning to petition the president to fast track approval for this drug because it's currently not approved for use in COVID. So, as much as we have quackery, we also have this desperation from healthcare workers. And then you have patients who would otherwise not follow, they know where to look for their information. And then they have their doctor who's desperate, who might say, well, I have this drug that could work for you. So they trust their doctors, and they get caught up in these things. And then you have the government that is, has to follow evidence-based guidelines and science, and not put the population in harm's way, and at the same time not promote any kind of treatment that's not effective, even if it is safe for use and it's not going to do anything to you. It won't do anything to the coronavirus. So they also have to protect the population. And then you've got this massive movement on the ground. So I think there's a lot of tensions at the moment. But then to respond to the question about, whether people trust health services, when you have no other source, when the only clinic you have is like within 100-kilometer radius, and that's where you're going to go, whether you are sick, whether you've been stabbed, whether you've broken a limb, you don't have a choice. So I think a large proportion